put it in my mouth?
Do I want to put it in Hannah's mouth?
Yeah, sure.
Okay, all right, come here.
Today I'm going to show Lexi, since she's going to dental school, how to take impressions. Even though everything is pretty much using a scanner, like we have one here, you still need to know for now how to take a regular impression. And you always want to use really good impression material. Invest in good material. Everything in this office is Ivoclar. Ivoclar is absolutely my favorite and the best. You load this in a gun, and in the old days you would mix it by hand.
Right.
This is a lower tray, so there's room here for the tongue. You would try it in the patient's mouth, so you want a passive fit in the mouth.
So you want them to be directly in the center of
Yes.
this space. Okay.
Yes, and go all the way back to the most distal tooth. This is not a denture tray. This is a tray for teeth. So for study models or for a crown bridge type of impression. And it's a full arch tray. You want to keep the tip in at all times so you don't create air bubble. So that's a technique. You come up a bit and you fill it up, and you fill it up all the way to the top here. You don't overflow
So all the way to the brim.
Exactly.
Okay.
Turn it over, and one big tip is to kind of roll it in. You can't just put it in your mouth like this.
You're gonna choke.
So, yeah, use your finger to pull away the cheek, roll it in, line it up, make sure that it's in the midline, and then with a lot of pressure, evenly force it down. It takes 3 minutes.
Lexi, do you want to try it?
Yeah. I'm switching it out to just a light body that's actually expired that we just used for practicing. So that way we don't use our really good expensive material. I'm gonna use this instead. It has a lighter consistency, so it kind of flows more freely, but it'll work for all our intended purposes. You said start here.
Yes.
Yeah?
Bleed it first.
Okay. You see how it mixed? Yeah, there we go. That's why we bleed it. I like the white and the orangey color are together. Okay, so we'll start down here, keeping the tip in. Is this looking correct, Dr. Smith?
It looks good, but you're going a little too slowly. Remember,
Oh, okay.
Yeah,
Right, it's gonna
about
set.
a working time, and hold it over because it's,
Oh, yeah.
You're doing great. You're keeping the tip in there to avoid bubbles, so that's really good.
Okay, so usually we would fill it up higher,
Yep.
right? But then you would turn it over.
And at what point do you put this in the patient's mouth? This part?
Now.
Now.
Right now.
Yes.
Do you want to put it in my mouth?
Do I want to put it in Hannah's mouth?
Yeah, sure.
Okay,
All right,
come
here. She's helping me out. Okay. Come here. Okay, I'm gonna...
Is it for lower or upper?
Lower. So I'm gonna roll it in.
Good.
And then...
Okay, it's kind of in the midline. And push down. There you go.
This is crazy.
Raise their tongue up and out,
Are you gonna gag?
and now relax.
Do I keep pushing it down?
Yeah.
Okay. And then we're gonna get a really pretty mold of Hannah's mouth.
Hannah's thinking, why did I volunteer?
I love it. It's minty.
Is it?
Uh-huh.
Mic roll.
And this is the other thing that we teach people to talk and ask questions while the patient can't speak.
Tell me in great detail about your week.
Go.
It's getting harder.
Yeah. Mouth set time 2.5 minutes. If the patient is gagging or having a hard time, you can just tell them to lower their chin down to their neck. And you can also have them focus on raising one leg. And that will definitely distract their brain from thinking about gagging.
I'm drooling a little.
And one other tip is if they're a terrible gagger, you can put salt on their tongue, and that also distracts them. She has very good saliva flow, so they're all gonna have.
Not to drag.
Yes, please bite my fingers as you speak.
Alright.
I think we're good.
So when you want to take the tray out, you want to grab it firmly and pull with some force and take it all out, and again roll it out. And roll it out.
Sorry, girl.
Yeah. Very good.
Very good.
Ooh, look at that. There's her teeth.
Very good.
Yay!
Hey, great job. Seriously, that's really good.
Oh my gosh, that's literally the first time I've ever done this, so that's very exciting.
Awesome. Awesome. Really happy for you.
And we used the cheap stuff.
Yeah.
We didn't use Ivoclar.
I'm gonna keep this in my room.
Ivoclar, we love you. Hit us up.